Hello everyone, welcome to another video. So in today's video we'll be looking at rheumatic heart disease. Basically rheumatic heart disease is actually a long-term damage to the heart valves, and it occurs after an abnormal immune reaction to an infection with the Streptococcus bacteria. This Streptococcus bacteria is actually the same bacteria that causes strep throat or scarlet fever. So it usually begins in childhood with a condition called rheumatic fever, which affects the joints, the brain, the skin, and most importantly the heart. Rheumatic fever, if it's not treated properly, it can damage the heart valves permanently, leading to problems with blood flow inside the heart. And rheumatic heart disease is a major cause of heart failure and death in children and in young adults in developing countries, including Nigeria. So basically, to understand this rheumatic heart disease, we'll look at the heart. So the heart is a major organ in the body, and it has 4 chambers with 4 valves. The mitral valve, which is between the left atrium and the left ventricle; the aortic valve, which is between the left ventricle and the aorta; the tricuspid valve, which is between the right atrium and the right ventricle; the pulmonary valve, which is between the right ventricle and the right ventricle and the pulmonary artery. So the valves, they ensure that blood flows in one direction, like the blood does not flow backwards, so it flows in one direction. And in rheumatic heart disease, the immune system attacks the heart valves, thinking that they are the bacteria, like they are the Streptococcus bacteria. And this basically causes inflammation, thickening, scarring, and narrowing of the valves. And the mitral valve is most commonly affected. Sometimes the aortic valve is affected, and the valves may become leaky or narrow, and they may disrupt like blood flow. So when the body fights off Streptococcus infection, it's actually like looking at the pathophysiology now. When the body fights off this Streptococcus infection caused by this Streptococci bacteria, so it sometimes mistakenly attacks its own tissues, especially the heart valves. And this autoimmune reaction causes acute inflammation of the heart, as is seen in rheumatic fever. Then repeated or severe episodes usually lead to permanent damage to the heart valves. And damaged valves, they cause blood to leak backwards, because these valves are basically not able to do their job anymore, like to allow blood to flow in one direction. So these damaged valves, they cause blood to leak backwards or flow poorly, leading to heart enlargement, heart failure, irregular heartbeats, clots, or stroke. So these are basically all the things that can happen when the valves are not working properly anymore. So for the causes, the main cause is having an untreated or poorly treated throat infection with group A beta hemolytic Streptococcus bacteria. So repeated infections increase the risk of heart damage, and poor access to health care, overcrowding, and poverty can make this condition worse. So the main cause is when you have an infection with this Streptococcus bacteria and is not treated well, is left untreated, or is not treated well at all. So for the signs and symptoms, so during rheumatic fever, which is the early stage, there will be fever. As the name implies, there will be fever, there will be joint pain and swelling, there will be chest pain, there will be fatigue, there will be skin rash or lumps, there will be uncontrolled body movements, especially in children. So later in the chronic stage, when rheumatic heart disease is now involved, there will be difficulty breathing, especially when you are lying down, swelling of the feet or ankles, chest pain, palpitations, feeling like your heart is racing or skipping, coughing up blood in severe cases, tiredness and fainting. So these are what you see if it has gotten to the chronic stage. So for the diagnosis is based on history of the patient, medical history of the patient, physical examination and some tests. So doctor will ask if you have a history, if you've had an history of sore throat in the past, especially sore throat that was left untreated. Then there could be heart murmur, which could be heard on examination of the heart and this could be due to a valve leakage. Then chest x-ray may show enlarged heart. And then electrocardiogram, that is ECG, can be used to check for abnormal heart rhythm. And then echocardiogram, which is a heart scan, can be able to show this damaged or leaking valves. And blood tests, they show signs of recent streptococcal infection or inflammation. So all these tests can help the diagnosis of this condition. So conditions that can actually mimic the rheumatic heart disease include congenital heart defects, which can be present from birth. Then infective endocarditis, which is the infection of the heart valves. Cardiomyopathy, which is a disease of the heart muscle. And also some valve problems due to aging, which is known as degenerative valve disease. So for the treatments, so there are different treatments in different stages. So for acute stage, that is rheumatic fever, number one, antibiotics to treat the streptococcal infection. Then anti-inflammatory drugs like aspirin or corticosteroids to reduce inflammation. And bed rest too is needed in these patients to reduce the strain on the heart. Then for chronic stage, where the patient now has rheumatic heart disease, so we give long-term penicillin injections monthly to prevent further streptococcal infections. Then medications for heart failure are also given, such as diuretics, beta blockers, or drugs that just relax the blood vessels. Then anticoagulants, that is blood thinners, they're also given if there's a risk of having clots. Then surgery can be done to repair or replace the badly damaged heart valves, and surgery is usually like the last stage option in this kind of patients. So when the damage is very severe, we have to consider surgery. So for the management of this rheumatic heart disease, it's good for early treatment of sore throats. Like if you have sore throat, it's good to get early treatment with antibiotics so it will not develop into something more complicated. And then it's good to have for doctors or pharmacists or just people in the healthcare system that have patients with this rheumatic heart disease, it's good to have a regular follow-up for these patients that are known to have this valve damage. And then these patients have to go on monthly penicillin injection for years to prevent the repeat of these streptococcal infections. And surgical referral, like I said, it should be done if the heart function becomes very poor. So in summary, this rheumatic heart disease is a serious complication of untreated strep throat. So it starts as strep throat, and when this strep throat is not treated, it leads to this rheumatic heart disease. And strep throat is more common in children. So it results from the immune system attacking the heart, damaging the valves. And proper treatment of sore throat, regular use of preventive antibiotics, and monitoring of like heart health can actually help to reduce the long-term effects. So pharmacists should play a crucial role in prevention, education, and medication management to improve outcomes for patients living with this disease. So that is basically it for this rheumatic heart disease. So